Hello everyone, welcome to pathologymcq.com. We will be discussing a few questions in CNS pathology with answers and explanation. First question. Most IDH mutant diffuse astrocytomas have the following mutation. And the answer is R132H mutation. What is the significance of IDH mutation? IDH is a marker of both astrocytic as well as oligodendroglial tumors. The most common IDH mutation, which is recognizable by immunohistochemistry, is IDHR132H mutation. This mutation also accounts for 90% of all gliomas with IDH mutation. This mutation has diagnostic as well as prognostic significance. This is an algorithm from WHO 2021, 5th edition of Central Nervous System Tumors. When there is a diffuse gliomatous histology, IDH by IHC is the next step, and if IDH by IHC is negative, IDH by sequencing has to be done to rule out the presence of IDH mutation, since we had discussed that only 90% of all IDH mutant gliomas are IHC positive. If IDH by IHC turns out to be positive, the next best step is to perform a 1p19q co-deletion status study. Similarly, if IDH by sequencing turns out to be positive, again the next best step is to perform a 1p19q co-deletion status assay. If it is negative, classify the tumor as astrocytoma IDH mutant. If it is positive, then it would be an oligodendroglioma with IDH mutation and 1p19q co-deletion. Let's move on to the second question. LRRK2 mutation is associated with which of the following conditions? And the answer is Parkinson's disease. Parkinson's disease can occur sporadically as well as it could have a familial predisposition. Familial Parkinson's disease, on the other hand, are inherited in an autosomal dominant as well as autosomal recessive fashion. The most important genes to be remembered in autosomal dominant inheritance is alpha-synuclein and LRRK2, whereas in autosomal recessive inheritance, it would be Parkin and PINK1 genes. Now let's look at the third question. Identify the condition from this cytology image. The answer here is oligodendroglioma. The cytology shows three main features of oligodendroglioma. First is a uniform sheet with disc-cohesive isomorphic cells, a vacuolated background, and the most important one, chicken wire capillary network, which is a characteristic feature of oligodendroglioma even in histology. Now let's move on to the fifth question. 40-year-old woman underwent muscle biopsy for progressive weakness. Which of the following is most likely diagnosis based on the image shown? Let us just concentrate on the image for a moment. So muscle biopsy, in between